Hi everyone, welcome back to the Learning Stethoscope. This is part 2 of our video on chronic venous insufficiency, where we'll dive into its diagnosis and treatment. Diagnosis of chronic venous insufficiency involves a combination of clinical history, physical examination, and additional tests. The most important diagnostic tool is Duplex Ultrasound, which is considered the gold standard. Duplex Ultrasound allows us to visualize the superficial, deep, and perforator veins, check whether the valves are working properly, and see if there's any reflux or obstruction. Sometimes we also use other tests. For example, plethysmography helps us measure how well the veins are functioning, and the ankle brachial index makes sure there isn't significant arterial disease before we start treatments like compression therapy. Now let's move on to treatment. Compression therapy is the cornerstone of chronic venous disease treatment. It's simple, non-invasive, and highly effective, making it a recommended option for all clinical stages, from mild symptoms to advanced disease. The main objective of compression therapy is to apply graded external pressure to the leg, which helps counteract the hydrostatic forces of venous hypertension. By doing so, it reduces venous pooling, improves blood flow back to the heart, and relieves symptoms such as swelling and heaviness. Now, there are different ways to deliver compression, but the most common are compression stockings and compression bandages. Stockings come in various compression classes, lengths, and designs, so they can be tailored to each patient's needs and comfort. We usually use graduated compression, meaning the pressure is tighter at the ankle and gradually lighter up the leg. This pressure gradient helps push blood upward, exactly the direction we want it to go. We usually use pressures around 20 to 30 millimeters of mercury for mild diseases and 30 to 40 for more advanced stages. As for length, knee-high stockings are usually enough. They're easier to put on, more comfortable, and patients are much more likely to wear them consistently. One important detail: stockings lose elasticity over time, so they should be replaced every 6 to 9 months if used daily. Having at least 2 pairs to alternate between helps maintain consistent compression strength. But here's the catch: they only work if patients wear them correctly and consistently. That's why education and proper fitting are just as important as the prescription itself. Important note: before starting compression therapy, we need to exclude arterial disease. So always check the ankle brachial index to make sure there isn't significant arterial disease. Now, besides compression, lifestyle and self-care measures play a huge role in managing chronic venous insufficiency. The first measure is leg elevation. Whenever possible, elevate your legs above heart level for about 15 to 30 minutes. This helps reduce swelling and encourages venous return. Then is exercise. Regular walking and calf strengthening exercises are essential. Every step activates the calf muscle pump, helping to push blood up toward the heart. Avoid prolonged standing or sitting. Staying in the same position for too long causes blood to pool in the legs. So, if you work at a desk or stand for long hours, try to move or flex your ankles every 30 minutes to promote circulation. Next is weight management. Maintaining a healthy body weight is crucial. Obesity increases venous pressure and is a major risk factor for developing or worsening CVI. Even modest weight loss can improve symptoms and reduce disease progression. Last but not least is skin care. Daily moisturizing prevents dryness and skin breakdown, lowering the risk of infection. These small lifestyle changes may seem simple, but together, they can make a big difference, improving comfort, function, and overall quality of life. Now, in addition to lifestyle care, there are supplementary interventions that can further help improve symptoms and outcomes. One of them is physical therapy. Rehabilitation programs usually include ankle mobility exercises, strengthening of the gastrocnemius and soleus muscles, and gait training to enhance the efficiency of the muscle pump, helping blood flow back into the heart, decrease swelling, and improve leg function. Another intervention is manual lymphatic drainage. This is a specialized massage technique that stimulates lymphatic flow and helps move excess interstitial fluid, reducing chronic leg swelling. It's often combined with compression bandaging to maintain the reduction in edema and optimize long-term results. Now, regarding medications, in the United States there are currently no FDA-approved drugs specifically for chronic venous insufficiency. However, in many parts of Europe and Latin America, several venoactive drugs, also called phlebotomics, are widely used to help relieve symptoms like leg heaviness, pain, and swelling. Some commonly used options include MPFF or Daflon and horse chestnut seed extract. Pentoxaphylline is sometimes used as an adjunct to compression therapy in patients with venous ulcers, as it improves microcirculatory flow and oxygen delivery to tissues. While these medications don't cure venous insufficiency, they can help control symptoms and support healing, especially when combined with compression and lifestyle modifications. Now, sometimes even after we've optimized everything, some patients still need interventional treatment. Patients with advanced disease should be referred to a vascular specialist. The choice of procedure depends on which part of the venous system is affected: superficial, perforator, or deep, and the options range from minimally invasive endovenous techniques to surgical repair in selected cases. Endovenous thermal ablation is a minimally invasive procedure that works by using laser or radiofrequency energy to cause a local thermal injury on the inside of the vein. This controlled thermal injury causes the vein wall to collapse, leading to fibrosis and eventual closure of the vein. Once that faulty vein is sealed, blood is naturally rerouted to healthy veins nearby, improving circulation and relieving symptoms. Next, we have sclerotherapy. Sclerotherapy, the injection of a liquid directly into the incompetent vein. This solution irritates the inner lining of the vein, causing inflammation and local thrombosis. Over time, the vein collapses and is reabsorbed by the body. There are different sclerosing agents to choose from, and the main advantages are that it's less invasive than surgery, can be repeated safely, and has a short recovery time, making it a great option for elderly patients, those with multiple comorbidities, or anyone who prefers to avoid surgery. Now, before endovenous techniques became popular, surgical ligation and stripping was the standard treatment. In this procedure, the surgeon ties off, or ligates, the problematic vein and then removes it, called stripping, through small incisions. And that's it. Chronic venous insufficiency explained. If you'd like to review this topic in more detail, you can get the complete clinical notes for this video. Check the link in the description below. Don't forget to like, share, and subscribe to the Learning Stethoscope. Stay curious, and I'll see you in the next video.